Okay. Then 7th is pre-treatment communication or consultation with the patient. This is must before you touch the patient. Without telling anything, if you start, no, within 10 seconds he will ask, sir, it's over? After 1 minute, sir, still going? 1.3 minutes. Sir, when it will be over? 2 minutes. Sir, is there any trouble? 2.3 minutes. Call your chief doctor. So you have to inform the patient. Create the proper, you are in the right mindset. So you have to give the right mindset to the patient. You have to tell. This tooth is not like some other tooth. The roots are very strong. It's a root canal rooted. There is no crown structure. If there is crown structure, we can hold with the forceps, right? SS dog. But there is no structure. But don't worry, we have special equipments and instruments. We will remove it. But it will take time. We will do it slowly. Are you in a hurry? You want to go somewhere? No, doctor, you can do it. It will take around 30 to 40 minutes. Even 1 hour it will take. You give the higher range to the patient. Then they won't disturb you. The moment patient becomes tense, anxious, and he asks some questions and he is showing signs of anxiety, it infects you. You become more tense. The procedure becomes more delayed. Having a proper mindset for you and creating a proper mindset for patient, it is must. So you can create proper mindset to the patient only if you are relaxed and if you have proper mindset. Right, okay. So before consultation, you tell it. This is a challenging tooth. There is no crown. Better you come in the morning. I also will be fresh. There won't be any patients. We can tell like that. Do it in the morning. Many patients prefer morning. They do it in the morning and they go by 8:30 to their office. Right? Now we are going to start the procedure. Okay, before that I will finish. In armamentarium there is one important thing we didn't add. One is piezo. If you are in the beginning, early initial learning stage, this will help you a lot. Piezo. Regular extraction also, there is one protocol you have to follow when you are using piezo. First you have to use this tip, then second you have to use this tip. Then you can, your difficulty index suddenly becomes less. Right around. The more chances for success will be there. The less chances for breakage or less chances for headache will be if you use piezo. I will highly recommend using piezo. And there is one more magnetic mallet, right? There is one technique is there, magnetic mallet. It will chisel kind of thing. It will push into the periodontal ligament. If I have not used it, you have to try it. Okay. And there is one more thing is physics forceps. We have tried it, but that also we are not very much comfortable. We don't know. Of course, we bought physics forceps, not the original one, so we don't know the real feedback. Okay. So in all other segments, there are a lot of technological advancements. We go to ortho, Invisalign is there, self-ligating is there. We go to endo, injectable condensation, the micromotor instead of hand failing. A lot of technological advancement is there, implantology anywhere. But when it comes to extraction, there is not that much, nothing is there. The same forceps design for 100 years, the same elevators, the same extraction principle. 1964 first edition of Jeffrey Howe, it is still the same. Still, it is the recommended book. Right? So it's more of your manual skill. Other departments you can compensate by using technology or thing, but here you need to have a real skill to do this. Okay. So how to learn this? So what we have to do from our side is, first one is read books. Read books. Daily 10 pages related to extraction or minor oral surgery, suturing, bleeding management. Okay. The first book is Jeffrey Howe. You should at least read 10 times, if not 100 times. Even after 10 years, you will get a new point from Jeffrey Howe. It is a must book. The second book is Peterson. L.J. Peterson, Contemporary Oral Maxillofacial Surgery. There is one PG book is there that is available in net, but this I couldn't able to find out. Peterson. Yesterday I saw SM biology book. Okay, it was very good actually. It was very comprehensive. Okay, many good points are there. You can read some biology. Or Srinivasan book. Srinivasan book is there, right? B. Srinivasan. Whatever book is there, in PG I did like that only. Whatever books are there under the roof, under this extraction, impaction, canine impaction, suturing, whatever it is, I read every articles, every books. Somewhere you will get one points. Never stop reading. Because having a minor oral surgery skill, no, it will give you, our career will jump very faster. Right? Next, listen to lectures. Thanks to Google uncle, you are getting lot of good lectures, right? But we are not using. George Paul lecture you should see. George Paul, you know, right? There is one channel, Henry Shane, one channel is there. In that there is some good lectures are there coming to. George Paul is a good, orator, lecturer. You will love listening to his lectures. Some 2 or 3 lectures are there in net. Okay. And third one, see procedure videos, extraction, tons and tons of videos are there. See procedure videos. Even in our channel there are a lot of videos. Lot of 8 extraction videos are there in us. We wanted to remove it, but we are not seeing. You are not seeing 8 extraction videos in our channel. Okay, good. Then observe, assist, live. Okay, that gives you more. So you can correlate whatever lecture you listen, whatever book you read. You can correlate and you can observe. So I have written it lost, no, because this is not in our control. But the first 3 things are in our control. Do that first. Don't try to jump and observe, assist. Okay, this is the last one. If you don't finish the first 3, you cannot learn anything from assisting, observing. You will be like a layman. You will be seeing, but you will never get any points. You have to read. You have to listen to lectures. You have to see procedure videos. Then you assist or observe. Who is an expert? Then you will learn. Otherwise, there is no use. Then 5th thing is you have to try. Try and confirm. Hand feel later. That is the last part. If you do this 4 steps properly, this 5th, you won't feel like you are trying actually. It is a confirmation that you have learned. That's it. Any technique, this is the thing. Material, you need to have glucose. I forgot to tell you. Surgical area, glucose should be there. Because anytime the patient. Pulse oximeter, yes, excellent. Not the finger pulse oximeter. You cannot see finger. Yesterday patient was doing like this. He prepared our mindset before. Sir, I will be doing like this. You don't worry, it is my habit. The hands, it is shaking like. It is shaking like Prabhudeva. I was trying to put the drill in the correct position. This is shaking. So in that patient, if you attach the finger pulse oximeter, it will drop off. Okay. That Sri Lankan patient, she was wearing artificial nail. so it won't work. Luckily only one finger she left in the definition.
Nail polish.
The nail polish is there, then you cannot use that finger, then you have to use the nail polish remover or split. Okay, the anesthetists, they will have a nail polish remover with them too. So invest in a better pulse oximeter. We ordered online, right? 23 or 20,000 something. It will come for life if you handle it properly. You won't get any trouble. Okay, now during the procedure, what? Now you are going to, everything is ready, the room is ready, light is ready, tray setup is ready. Out of this, the main thing is ornamentarium. Definitely it will come around 2 lakhs, whatever, no, 3 lakhs piece, including piezo. Piezo 1 lakh, piezo how much?
Around 1 month.
1. Then other elevators, it will come 1 lakh.
You see any specific company?
Physio Marathon is there, Woodpecker is there, anything from patient eyes. After LA, the patient says, oh, it's over. Like this. Okay. Okay. So during the procedure, what things? Okay. First thing what we need is sufficient LA, proper LA. Make sure proper LA. The mistake what we'll be doing here is, after giving LA, you have to definitely make the patient sit outside. Never keep the patient on the same chair. Because you have to wait at least 5 to 10 minutes before you start the procedure. Then only the anesthesia will come fully. But if the patient is waiting here only and you wanted to start soon, within 2 or third minute you will be not using the forceps. In our city, this problem happens when the consultant comes. He gives LA and immediately he takes the handpiece and do it. You have to wait for at least 5 minutes for the full anesthesia to come. Right? So if the consult is coming, better you give LA and make the patient wait for even 20 minutes, so no problem. But if he gives a block and immediately he takes the handpiece, then you will have pain. So sufficient time we have to wait. So after giving LA, nothing wrong in making the patient wait 10 minutes, 15 minutes also okay. My sir used to make the patient wait for 20 minutes. Okay. So this is essential, because if LA is not working, your armamentarium, your skill, everything, you cannot apply anything. So this is a separate topic. How to give a proper LA, what are the challenges, difficult cases, how to handle. In PG stages, people will call because of this reason. Sir, I was trying, I couldn't able to achieve anesthesia, please come. Okay, so this is important. The second thing is, as she told, ergonomics. If a person is telling I couldn't able to extract the tooth, most of the main culprit is this ergonomics. You can tell. Not other things are not very important. If you have the proper ergonomics, then the treatment is a success. In colleges now, the students will come and ask the tooth is not coming. The first thing I will adjust, I will adjust the chair height, the backrest angle, the headrest angle. Okay, these are the things. Okay, so first thing is what is the height, then what is the backrest, then the headrest. For maxilla, the patient head, the neck should be fully visible, then only it is easy. If you operate on maxilla in this position, then you have to bend like this, then okay. For mandible, the occlusion plane should be parallel to the floor. This is a very simple principle. For maxilla, the maxillary occlusion plane should be 45 degrees to the floor. Okay, then only you can handle the biomechanics, everything will be easy. So ergonomics consists of two things. One is patient related, one is doctor related. So where we are sitting or standing. Sitting is not at all, I will not recommend at all. In the beginning stage, even in the advanced stage, I prefer doing in the. You can easily shift your position now. You can move yourself within the place, but if you sit, you cannot move freely. Right? So all the surgical process I recommend doing standing first. Okay. Previously I used to stand and do only. But I went for a Melos course. He was doing standing only. Daily 3 or 4 full mouth they are doing. But everybody they are doing, in the standing position only. So I was thinking why they are doing. Because they have to move, no? They are drilling from behind and they are drilling from here. So if you stand and operate, cannot do it. Okay. When it comes to giving LA or minor surgery, better to do in the standing position or the sitting position. Okay. Then where we are standing. Okay. And other thing is, what is your floor and what slipper you are using. This matters. Okay. So to remove the tooth, you have to give some force, right? To give some force, it has to come from somewhere. Huh? Either it will come from our wrist. Okay, you do like this, like this. Okay, after joining PG, 4th day I was having a swelling here and I was having pain. I couldn't able to move because in 1 year house surgeon we did 50 extraction. The first day we have to do 50 extraction. Okay, so I was doing like this. So it's too much of stress. I am creating forces from this wrist. Then I was thinking, if it is like this, then I cannot practice anything. Then I was reading what is the solution. Then I read in the book, wrist lock should be there. The wrist should be locked when you are operating. The wrist should not move as much as possible. Especially when you are applying with forceps, you cannot do like this. Okay. So where the force should come? From here, from shoulder will come. A good surgeon will give force actually from the legs, the foot. So you will feel the pressure on the foot, then you will apply the force. Right? Have you felt that? Okay. So if you are just applying pressure from shoulder, that is not enough. You have to feel from the mother earth, the force should come. We are getting support only from floor and we are giving force, right? So that should not be slippery. Okay, if you are using a slippers which is slippery, you cannot, you won't give enough force here. So I will remove the slipper and I will keep my, or otherwise I will take support from the chair border. Okay, so this is very important, and your legs should be wide enough. If you do like this, you cannot give force. So you have to